Well, if you're considering a hip replacement, we've got details on the latest technology that will get you up and walking soon after your surgery. And here to tell us more, Dr. Broome with the South Texas Spine and Surgical Hospital. It's good to see you. Thanks for coming in.
Good to see you. Thanks for having me.
You know, anyone who has hip pain knows that a hip replacement could be on the horizon. And in the old days, that would be a pretty daunting situation. But technology has changed, right?
It really has.
Yeah.
You know, we still get that. The people come in, they need it, they've been told they need it, but they're dreading it because they've heard all the horror stories of, I'm going to be laid up in bed for weeks, I'm not going to be able to cross my legs, I'm going to be hurting for months, and it has just really changed dramatically. We can really get you back on your feet quicker.
So what is this new technology, and how does it differ from, you know, the hip replacement?
For one thing, our implants are better and they last longer, so we can put them in younger people. But the way we put them in, traditional techniques, long incisions on the back side of the hip, they cut muscles and tendons. That causes pain. Those things need to heal. You're very restricted afterwards. It worked good, but you had a lot of time of healing. Now we can go through the front of the hip, smaller incisions. We don't have to cut any of those muscles or tendons. So, I mean, people walk literally a couple hours after the surgery and take no narcotic medications. And so we're really getting people back to life and to work and doing things they want to do much quicker, things that patients want and need, and what we've been striving to do for years. So it's working. You
know, that is amazing, because when you hear hip surgery, you think you're going to be down for the count. This is video of a recent patient. He's had both hips replaced?
He had both hips replaced at the same time. Both were extremely bad. And this is him at his first visit 3 weeks after surgery. But he's already back to work. He's ditched his walker. No narcotic medications whatsoever.
Wow.
And but it's really a testament to, we've spent countless hours of research making better instruments to do this with, better pain management techniques and stuff. And it's constantly evolving. We're constantly researching this, but it has gotten so much better. It's really exciting on our end just to see the changes and see the transformation you have in people's lives. And
these instruments are custom. It's a lot more newer technology than things are in the past. Is that what kind of sets it apart?
It really does. I think, you know, there are other people, the anterior approach to the hip is when it goes through the front side. This has been popular since the late 90s, and it's been growing. But what we've tried to do with our research and newer techniques through the years is really refine that and add to that the better pain management techniques. And the whole goal is the less tissue trauma we can create, the quicker you're going to bounce back and the less pain you're going to have.
So here's the deal. It's hard to cover all of this information in the short time we have here. You host informational sessions where people can come and they can learn and ask questions. Kind of describe what that session's like.
We're going to be holding another seminar coming up. It's basically a total joint seminar, but we're really going to focus on what's new with hip replacements. I'm going to talk about a little bit of all kinds of joint replacements. So, but what's great is it's free. You know, RSVP please. Last one was standing room only. We filled up fast, but it's a free chance for patients of any walk of life to come in and ask questions. You know, I'll give a brief talk and then at least 30-45 minutes of just Q&A. I mean, people have brought their x-rays. What do you think? I mean, legally we can only give so much medical advice, but it's a really good informative session. A lot of people just need another opinion. They're riding the fence, and it's a good way of saying, you know what, pull the trigger and get it done. But it's come one, come all, and feel free to don't hold anything back. Ask any questions that you want.
You don't have to live with the pain anymore, right? It can be fixed and it can be done quickly.
Get your life back.
Absolutely.
You know, that's the goal.
Thank you so much for coming in and sharing all this information with us. I want to give you details about the hip pain seminar. Like we mentioned, standing room only. So make sure you call and let them know that you're coming. It's Thursday, July 19th from 6 to 7:30 at South Texas Spine and Surgical. You can go online at southtexassurgical.com, but do call and let them know you're coming. The phone number is 210-361-7537. It's the South Texas Spine and Surgical Hospital 361-7537. All right, coming